The first time I was ever exposed to a G-tube was actually when I was 10 to 12 years old. There was a little girl at church who was born with a syndrome where she was missing half of a chromosome. My mom was paid to be her attendant, and I had the honor and privilege, unbeknownst to me at the time, of helping take care of this tiny little baby with my mom. I learned how to hit the buttons on the pump. I learned how to watch her so she wouldn't pull her G-tube out. One time the G-tube actually came out on my watch, and I don't remember the details, but I just remember being so afraid that the G-tube had come out on my watch. Fast forward 20 plus years, and here I am with a medically complex child who needed a G-tube at 3 months old. By the time we heard that she needed a G-tube, I was relieved because at the time she had been wrestling with an NG tube, which is a nasal gastric tube. It goes through your nose and into the stomach, very uncomfortable. And for a baby, you're so afraid it's going to come out. At that point, we had already accepted the fact that our girl couldn't eat. She couldn't swallow like a normal child. And I was just so excited to be able to hold my baby without worrying about the tube. But once you get the G-tube, there's so many questions like, can she take a bath with the G-tube? Does it hurt her? I see people twisting it. Is that good? Is that bad? Does it cause pain? How do I keep it clean? Becoming a parent with a G-tube baby, there's a lot of emotional aspects to it. If you're watching this video, you've already been there or you're going through it at this time. Watching your baby be fed through a tube is a very emotional thing. It's gross to a lot of people looking on the outside. But then at the same time, it's a relief for us who are battling giving our child meds or giving them the nutrition they need. So a G-tube has two sides to it. It's very emotional, it's very traumatizing, but then at the same time, it's beautiful because your child is now fed. In this video, I would like to show you what happens when you're using a G-tube, how to change the G-tube, a little bit blurred out for my daughter's privacy's sake, and how to clean the area around it. And then just a few frequently asked questions at the end. My daughter only has a G-tube. She doesn't have a GJ tube. As I've said at the beginning, my daughter does not have every single diagnosis that your child might, but I hope that this will give you some tips for taking care of your child coming home with a gastric tube. This is what a G-tube is. When you see a child with a G-tube, you'll most likely see this part. What's behind this G-tube? A G-tube is this little device that's put into a child's stomach. So they bring up the stomach so that it's basically stapled. I know that's a hard word to hear, but all the space between the stomach and the skin is basically this much. You put a G-tube in, and you put it in the skin, and you fill it with water. See that? And see, all of the G-tube is held in by is this little bubble. When you feed your child, what happens is you take this feeding tube, you untwist this, and don't worry, I don't have any food in here, okay? So let's pretend there's food in here. The liquid comes out this way, and it goes inside the tummy, and your baby is fed. It's nothing to be afraid of. It is not supposed to be that way, but some children have difficulties, and some children need help. So that's why they have a G-tube. Tissue always grows where a wound is. That's our natural body response to having a wound. Blood vessels go to that spot, tissue grows to try and protect the area from infection. With a child with a G-tube or a tracheostomy, which my child has both, granuloma tissue occurs. Also, inflammation occurs around the area of the site. If she pulls on the G-tube, pulls on the trach, etc., the more and more inflammation occurs. If it's not covered with something like gauze or preferably something thicker like Mepilex or actual cloth, then it's going to become red and irritated. I wanted to show you some of the hygiene products that we personally have used. We've used every single one of these, and honestly, it just depends on what's going on. So at first, we were using Desitin. It's pretty thick. Sometimes it's hard to rub around, and it does leave a residue, but it does seem to work pretty well. There's this one. It's just super thick. This is even thicker than Desitin, so we haven't used this very often. We do this if we want something thicker over a thin. So this is thin. This ointment is thin, and this is thin. So if you want to put something thin and then something thicker, you could use this. This one is a spray that I use like in a rush, but honestly, I don't know how much it helps her G-tube or not. Sometimes you could spray this like after the bath, and then you can put an ointment, like I mentioned, the zinc oxide, Desitin. There's also this one. When her G-tube site was pretty red, I got this one, and it seemed to help a lot with protecting that area from getting infected. This one is the typical one we use just during daily hygiene. So let's say it's not red, there's not much granuloma tissue, and we just want to protect it and prevent. This is what we use. So long story short, if you just want to protect and prevent, you could use these three, okay? But if something actually is going on and you want to protect it more and you don't have a prescription or you don't have the mental energy to ask for a prescription, you could use Desitin, Zinc Protect, or Fragile Skin. We also use these little G-tube covers I got on Amazon. I'll put the link in the description. These are washable. We put one new one on Paige every day. If there's actually an infection going on, we'll also put a piece of Mepilex under there, something thicker. Gauze doesn't seem to work well for us, and it can get attached and stick to the skin. So we decided to use something like this that we can wash and reuse. I hope that helps. So right now, after we set up the G-tube, we have all the stuff over here. We have the G-tube ready to go in the lube. This is sterile water, 5 ml, and we have hand sanitizer to clean our hands. And then after we change the G-tube, we're going to use a Q-tip to apply the Fragile Skin ointment, and then we're going to put the cover on. First thing you always do is you get an empty syringe to take the water out. So this is the same exact syringe that comes in this. As you start collecting supplies, you're going to have several of these. Another option, if you don't have two, is you use this one to draw out the water. You discard the water and then fill this with new, fresh, sterile water if you use the same one. We happen to have two, so we're going to use two. You're going to want to have two. This is an unopened box for a Mickey feeding tube. We're going to change her G-tube, so I want to show you how to get this set up. You always check the size on the box, check the size right here. The 1.2 centimeters is how far it goes in, and then the 14 French is how wide the G-tube is. It typically comes with gauze. We never actually use this when we change a G-tube, so we save this for later. What you could do is you could cut this in 4 and use it for trach care. All right, it always comes with a little set. It comes with an extension. This is an infant extension, okay? Infant, not oral. So we can save this for her feeds. It comes with a bolus extension. This is one that goes straight into the tube like this. And you can do a bolus or like a continuous or like a gravity feed. The thing with these is it just sticks straight out of the tube. So you can't just leave it on the patient. It comes with a syringe. So this is an Infant Vesco 35 ml syringe. You can see my video on the different types of syringes to see if that'll be helpful for you. The way this sits in the stomach is this fills up like a little water balloon and you fill it up with this. So we're gonna test it. The water that goes in this is sterile water. So something like this, sterilized water, boiled water, you could use distilled water. It just has to be sterile, okay? The way we test this is we wanna see if this part inflates. So how we do that is we stick that in there. Typically it's 5. For this one, it's 5 ml of water. As you can see, it is inflating. There's no leakage. There's no holes. Everything looks good. So that is how you test the G-tube. When you set this in the stoma, when you blow this with water, this is what keeps it secure in the stomach, okay? And then the food goes through this tube that runs through this balloon, okay? Next thing you want to do after you've tested it is you lube it. So some of these come with lubricant. It's actually been a while since ours came with a lubricant. You may have to buy these on your own or use a bulk lubricant. Take this, and what I do, I just stick this in there and I squeeze up a little bit so it's covered. It doesn't have to be a lot. It's just to help it go in, right? And then what I personally do is I leave this in here until we change the G-tube. Now we are ready to change. After we set up the G-tube, we have all the stuff over here. We have the G-tube ready to go in the lube. This is sterile water, 5 ml, and we have hand sanitizer to clean our hands. And then after we change the G-tube, we're going to use a Q-tip to apply the fragile skin ointment, and then we're going to put the cover on. First thing you always do is you get an empty syringe to take the water out. So this is the same exact syringe that comes in this. As you start collecting supplies, you're going to have several of these. Another option, if you don't have two, is you use this one to draw out the water. You discard the water and then fill this with new, fresh, sterile water if you use the same one. We happen to have two, so we're going to use two. You're going to want to have two people here, but to be honest, we've had several times where we're by yourself, so you're going to get used to that. Always remember, if there's not a lot of inflammation around the G-tube, you can twist it. If it's too loose, you're gonna feel like very little resistance. And sometimes it's because you need to change it and put more water into it. All right, so the first thing you're gonna do, this tip goes in this hole right here. Push this in, and while you hold the G-tube, pull the water out. And then you have to keep pulling this out while you pull the syringe out of the G-tube because there's pressure there. Now look, there was only 4 ml. That means 1 ml slowly came out. That's why you change these every couple months or so. Keep this down. Take that over there. Have your partner hold the G-tube down if you can. If you're by yourself, you'll just cut this beforehand. Use a saline wipe. This is what I do to kind of clean the area after. Have your new G-tube handy and ready, so it's right there. The G-tube hole doesn't close as fast as the tracheostomy tube, but you do want to do this pretty fast. You simply pull this out, and a little gas will come out. That's natural. You clean the site, and then we're going to put the new G-tube in there so it's lubricated. Take this off. Pop. It should not be that difficult. If it's extremely difficult, that means your child may need a different size. Sometimes you have to force it, sometimes you don't. Now you insert the new syringe again. This has over 5. We're gonna push 5 in. So it's gonna end about there. And then, as you can tell, if you don't hold it down, the water will start coming out. So you pull it, push it, and then draw it out like that. We might wipe off the residual lubricant just with a baby wipe like this. Then we're gonna use the Q-tip. Put some of this fragile skin cream on it, just a little bit. This is also what we do after the bath, like this. We're gonna put the cover on. Put the cover on. And we are done. If this is old, we discard it. This is just residual food. So we personally are gonna clean this and use it as a backup. We're gonna throw away all of this other stuff like the wipes we used, the Q-tip we used. We're gonna set this aside. We'll put it in a plastic bag and we're going to sterilize that later. Hope this helps.